So I'm going to review the paper Nebulized versus intravenous tranexamic acid for hemoptysis, a pilot randomized controlled trial. This was recently published in Chest last month. They conducted a pragmatic, open-label, cluster-randomized, single-center pilot study in which they randomized patients to either nebulized TXA at 500 milligrams 3 times a day versus intravenous TXA at 500 milligrams 3 times a day. Anybody that required immediate interventional procedure or mechanical ventilation were excluded from this study. So generally speaking, it was your patients that were coughing up blood but didn't necessarily require an immediate intervention. They randomized 55 patients each arm. They found it significantly shortened the time to hemoptysis cessation in the nebulized TXA group versus the intravenous TXA group. They also found fewer patients in the nebulized group required bronchial artery embolization, and discharge rates from the emergency department were nearly half in the nebulized group compared to the intravenous group. Though I must caution you that their definition of emergency department is more like an observation unit, as their typical length of stay was around 36 hours. So this may not be completely applicable to your setting if your emergency department does not use an observation unit for this, but it would suggest that potentially you can start this intervention in the emergency department with potential beneficial outcomes.